Welcome everyone to our session, A View from the FDA, Cybersecurity in the Healthcare and Public Sector. My name is Carl Wright. I'm the Chief Commercial Officer at AttackIQ. I'm joined today by Dr. Suzanne Schwartz from the Food and Drug Administration. So let me give you a quick background on Suzanne. It's quite amazing. Suzanne has an extensive background in cyber and is currently serving as the Director of the Office of Strategic Partnerships and Technology Innovation at the FDA Center for Devices Radiological Health, also known as the CDRH. Her work in medical device cybersecurity includes raising awareness, education, outreach, policy, development, partnering, and coalition building within the healthcare and public health sector. Suzanne has been recognized for excellence in the innovation at the FDA Women's History Month for her work in medical device cybersecurity. She also chairs the CDRH's Cybersecurity Working Group, as well as co-chairs the Government Coordinating Council for the Healthcare Critical Infrastructure Sector. And most recently notable, she's the recipient of the HISAC 2021 Ruthie Award in recognition of her leadership in healthcare cybersecurity during a global pandemic. Welcome, Suzanne.
Thank you, Carl. It's a pleasure to be here.
Well, Suzanne, it's great to be back on the virtual stage with you. Can you tell us what you're up to at the FDA these days?
Sure. A lot of really exciting stuff going on. Of course, my office was very much engaged and still is engaged in the public health emergency response to COVID-19. I want to talk a little bit, though, about our broader portfolio, which includes the establishment of the Digital Health Center of Excellence. And the DHCOE, which is what we call it for short, really amplifies the place where we are today and where we're heading as a nation, as a global community as well, in terms of medical technology and its expansiveness well beyond the brick and mortar facility of the hospital, but also for individuals who are walking around with medical devices, who are utilizing medical devices that are residing at home, that are in other types of environments. And so it really represents where we are heading in as far as a lot of the emerging technologies to meet the emerging needs, which were very much surfaced through the COVID-19 response.
I mean, it sounds like a significantly challenging mission. And, I think 2020 was particularly a difficult year for so many people, but particularly the provider networks, that were helping so many people. In one of the previous tracks of Purple Hats, they talked about the healthcare system being under siege, and they were specifically addressing ransomware. And I know that, the FDA, is pretty aware of the challenges that they're facing. What's your perspective on the situation?
Yeah, I have to say, just even paying attention, of course, to everything that's going on around us today in the news with all of the cyber attacks, cyber campaigns occurring across critical infrastructure. And folks often forget that healthcare and public health is actually one of the sectors of critical infrastructure. We have become that much more reliant on the need for these technologies that have to operate remotely, that are interconnected, that are interoperable, and that rely on the capabilities of cyber networks. And so that puts so much more of a light to be shined on the need for robust cybersecurity within the healthcare sector. As you've mentioned, Carl, we've seen a fair number of ransomware attacks occur over the course of the past year, over the course of the pandemic. And when you think about the additional strain that puts on the healthcare environment, which was already taxed, which was already overly stressed and strained by numbers of patients coming into hospitals and the numbers of patients needing to receive critical care, and then putting those healthcare institutions in a compromised situation as a result of a ransomware attack really puts the entire critical infrastructure in jeopardy. It certainly compromises it. And the idea of thinking about these kind of hybrid, even emergencies, hybrid attacks, in that you're dealing with a pandemic, and on top of that, the overlay of the potential for a cyber attack is a shift in mindset, and one that we really need to be thinking about globally.
Well, and, obviously the FDA spends a lot of time talking to both the medical device manufacturers as well as the provider networks, right, that are providing this invaluable service to the patients. And I'm sensing, a real challenge because it seems like it's a patient safety issue, but you're dealing with a cybersecurity domain. So can you talk a little bit about that?
Yeah, a lot of our messaging, what we've been socializing, really tries to bridge those concepts in the sense that we view cybersecurity through the lens of patient safety. We do. Let's remember that FDA is a public health agency, and our oversight is to ensure that these devices, these medical devices, have a reasonable assurance of safety and effectiveness. That's actually the language out of the statute. And our mission is to protect and to promote the public health. If a medical device is compromised in some way, shape, or form, it could, just the same way it could be physically manipulated or compromised. If it's compromised through a cyber attack so that either the integrity of the data is in question, the performance and functionality of the device is in question, or it's actually even rendered inoperable, such as a denial of service, that means the device cannot operate safely, and it cannot deliver the intervention that it's supposed to deliver. That puts patients at harm. So it is important for us at FDA to further bring that level of awareness, that level of situational awareness to manufacturers, to healthcare delivery organizations, importantly to clinical providers who really, kind of view these as two distinctly different remits, cybersecurity and patient safety, but, bringing it together to understand there's a confluence here, and that FDA, in reviewing medical devices now that come in as pre-market submissions, cybersecurity is an integral component of that review to assure that a device, once it then goes on the market, is appropriately designed and developed in terms of even the threat modeling, that needs to go into it so that it can be resilient towards an attack.
Well, I've been hearing the word resilient quite a bit, but I haven't been hearing that, to be frank, in the healthcare sector. I hear it quite often in the financial sector, where, the regulatory bodies are coming into the banks now and talking about the resilience against ransomware and what's their, and they're thinking about it obviously from a customer-centric perspective. Are you backing up that data? What's your ability to service your customers? But it strikes me that healthcare has an even more challenging environment because of it's not about money, it's about lives.
Yeah, I think we have a ways to go in terms of developing resilience. There's no question around that. Our approach is one of the total product lifecycle, what we call TPLC. And now let's also impose or overlay the importance of the secure software development lifecycle. And what we know is that many medical devices today remain legacy devices or legacy technologies and equipment. They were initially designed and developed to serve, and they are capital equipment, capital investments that are made by facilities with the intent on being in clinical use for many years. We can talk about a decade or longer, 15 years, in some cases 20 years. So when you think about the genesis of those devices, some CTs, MRIs, others, they certainly were not built at that time with the vision or recognition that we would be encountering what we're encountering today, and the need to be able to, in a very agile way, in a very nimble way, withstand the ability for updates and patches on a regular basis and fixes without, I use the term brittle. So the opposite is, in other words, being, we want them to be resilient. We want them to be able to take on those patches, those updates without any impact towards their performance from a safety perspective. And so that's where there is a way to go. And this is actually a focus of not only efforts that FDA has, but working, across global regulators and the global industry, the International Medical Device Regulators Forum, as well as within the U.S. and through public-private sector partnerships on legacy technologies being one of the biggest challenges we have towards, as you're pointing out in finance, towards reaching resilience.
Yeah, absolutely. Well, I mean, several years ago, we were on stage together at Black Hat, and we were talking about medical devices. And, one of the examples we had was a blood gas analyzer that was still running Windows 2000, obviously, a very old operating system that doesn't have any patches available. And, we've spoken many times in the past about common misconceptions regarding medical device manufacturers and FDA certification and what can be done to secure these devices post-certification. Can you dispel some of the myths that are pertaining to these medical device security and how organizations can augment cyber defensive capabilities for them?
No, absolutely. And in fact, we keep on hearing the same refrain from many medical device manufacturers, particularly the folks that they send out on behalf of their company, on behalf of their product to healthcare delivery organizations, indicating that we're not able to do anything in terms of deploying patches because that will, quote unquote, decertify the device. We'll have to go back to the FDA in order to make sure that the device is still FDA certified. Because of this, we put out a fact sheet. I actually have the FDA fact sheet right here. Let me see if this is going to work. But just so people know that they can refer to it off of our website, our FDA website. And it speaks of, several things that we try to myth bust on. One of them, I'll say, is cybersecurity for medical devices is optional. That's certainly not the case. We view medical device security as really part of the quality systems regulation under that larger umbrella. It might not have said cybersecurity going back years ago in the regulation, but because of our ability to evolve our thinking when it comes to risk management, cybersecurity falls under that larger remit. And therefore, cybersecurity of medical devices is not optional. And we are not going to clear or approve medical devices that do not have adequate cybersecurity, number one. Number two, we've taken actions post-market on devices that are not cyber secure and that have what we call uncontrolled vulnerabilities that simply don't have the adequacy of compensating controls or abilities to mitigate against the potential for patient harm if the vulnerability were to be exploited. So that's one. Another one that you pointed out to, which is a really important one, is that medical device manufacturers cannot update devices for cybersecurity. And that's simply not true. We've stated in our pre-market and in our post-market guidance that changes made solely to strengthen cybersecurity do not require coming back to the FDA for a new submission. They are considered, again, appropriate changes to be made, and they should be made. You'll see more of that because what's happening right now is, as this field continues to further evolve in cybersecurity, we're hearing about all kinds of other new potential technologies that can assist with healthcare delivery organizations in further securing what are older devices. And questions are coming up and are being brought to FDA all the time around, well, the manufacturer tells us that we're not allowed as a healthcare organization to do anything because that will take away the certification of the device. And some of these we have to handle case by case because they are newer. However, the majority of the, again, concept here is one that medical device manufacturers really need to be updating their devices when a vulnerability is identified, when patches are out, it's their responsibility to do so.
It is really encouraging to hear that, the FDA, is publishing this and that this information is out there, and that both obviously the medical device manufacturers and the healthcare organizations can take advantage of that to make better decisions. And, if the medical device manufacturers are responsible for, obviously remaining vigilant, because the threat landscape is changing constantly, right? And so they need internally to identify risk and hazards associated with these medical devices that they have, both legacy and new emergent capabilities that, create, advancements in patient care. But what roles do the healthcare delivery organizations have in this relationship then, as it pertains to the ultimate patient safety?
Yeah, important question. So we've always said, and this is not unique to healthcare, but really across all areas or all industries, that cybersecurity is shared ownership, shared responsibility. It doesn't sit on any one stakeholder's shoulders, but it has to be very much a collective effort, a partnership. And so one of the things that we state very clearly in the fact sheet and that we recommend all the time is that healthcare delivery organizations who absolutely want to be proactive and providing the appropriate defenses on their systems should certainly be reaching out to medical device manufacturers, particularly if they're not sure in terms of what they can or cannot do or should not do, because the best of all possible worlds is they work that together. We are, delighted to see that there's been a lot of progress, particularly over the past couple of years, in a pilot effort convened through the Department of Commerce's NTIA on, for example, the software transparency. And the pilot effort that was rolled out as kind of the inaugural effort on software transparency was taken up by the healthcare community, by several healthcare delivery organizations, their CISOs, working together with medical device manufacturers to come up with a framework, with an initial kind of first generation of SBOMs, of software bill of materials, and to utilize that upon which to build out further as something that could be operationalized and put to use within healthcare organizations in a more distributed in a more dispersed way. That's an example also of healthcare delivery organizations really, taking up the charge as they recognize their responsibility to protect their assets, to protect their systems from a cybersecurity perspective. And that means being in the know, being aware of all of the third party, for example, components that are sitting on their systems, sitting within medical devices. So we've been working together, with these stakeholders in terms of getting to that point of transparency. This is, it's not going to be a shocker or a surprise. Obviously, this is also very much in line with the new executive order by the president, that talks about, obviously, for systems that are procured for the federal government. We have a little visitor here. Want to say hello?
There you go. This is truly a virtual conference. You get everything.
Has to make her special appearance. What can I say? The president's executive order, which shines a light on the importance of software bill of materials and software transparency. And FDA said this back a few years ago in our medical device safety action plan, that's something that we are looking to require. It's certainly a recommendation already in our guidance, but we're, looking to assist both the healthcare delivery organization side, as well as obviously the manufacturers, so that there's, ability to protect and to mitigate against the possibility of what are going to be emerging vulnerabilities over the lifetime of device. This way, if you know where those vulnerabilities are, you can protect.
Yeah, and it's again, that's encouraging to hear. And obviously, the name of this conference is Purple Hats, which represents, from a cyber perspective, different teams coming together in a unified approach to, to protect the organization, right? And in common terms, is red teams and blue teams in many aspects that create the purple. But this is really the medical device manufacturers and healthcare organizations coming together, working together from a unified perspective in order to ensure, that patient safety and that these critical services can be delivered. So this topic fits, I think, perfectly into kind of our conference theme for today.
Well, that's great.
So one question I have to ask you is, in lieu of kind of third-party risk and all the different things, events of interest and breaches and incidents we've been dealing with in 2020, with third-party risk in medical device manufacturers and provider networks, how does the FDA think about this in relation to SolarWinds and some of the things that have been going on out there?
Yeah, I think like with everything else that's been going on, particularly over the past year plus, we really try to take lessons learned, whether we are dealing with something directly that from which there's something to be gleaned, be put into practice, or whether we're viewing this through the lens of what's happening within other sectors. And we had already been in the process of making our new pre-market guidance, which will be coming out as draft by the end of this year, a far more robust, really raise the bar in terms of what our expectations are of medical device manufacturers. And had that in the works already pre-pandemic, but there certainly were, through the course of this past year, and then obviously, examples like SolarWinds and other third-party SolarWinds certainly got the public's attention, as did the recent pipeline attack. But there have been a few that have been perhaps lesser known, but certainly ubiquitous third-party vulnerabilities that could affect many medical devices that we had to run multiple fire drills over the past year. And each time, looked at each other at FDA and said, now, if there were known inventory in terms of the third-party components that are sitting in all of these devices, how much more nimble all of us, the government as well as the private sector, could be in being able to, first off, identify where are the devices at risk, as opposed to across the board, the entire ocean. So there's that piece of it, and then the ability to not only know where they are, but then to be able to further assess for potential impact. Maybe the assessment of impact would be minimal and doesn't require any action. But so the third-party components or third-party software is an area of certainly of consternation, and therefore the importance of having again transparency around that and putting the SBOMs in place. And that's probably the biggest lessons learned, from watching what's been happening. The only other point that I would also make is that this is a little bit of diverging from third party, but recognizing that you'll hear, perhaps the attackers state, well, we're not, doing anything that's malicious that would cause people harm, harm to the public. What we're doing, might have some other criminal effect, but it's not intended to cause patient harm. What's not recognized there, though, are the cascading consequences or the ripple effects of any one of these that the attackers, whether they're nation states or others, may simply not be aware of. But we see those effects. We've seen them through the supply chain disruption all throughout the pandemic. Right. So it's not just simply about, not having ability to get gas at the gas station, but there are other ramifications of that actually can affect the ability to render clinical care. And that's why I think it's important to take on a more holistic view of cybersecurity for critical infrastructure, as opposed to, really looking at it through, very myopic or blinders on.
Yeah, I think you're absolutely spot on. Well, as you take a look to the rest of this year and your crystal ball in 2021, from your perspective, what are some of the important things the FDA that you can talk about are thinking about and we should expect?
Yeah, so certainly I know that our manufacturers, our industry, and the healthcare organizations as well are waiting with bated breath for this guidance to come out. This is a new iteration of a pre-market guidance that was issued years back, in 2014. We then put it out as draft again in 2018, got lots and lots of public comment on it. We took a real, a hard look at it and revised that draft significantly. So it will be coming out again. We're targeting the end of this year, 2021. It will come out as draft once more, which will allow everyone to provide public comment to it. But we think that this is going to be a really robust guidance. And in addition to that, we've also been very clear about the fact that we are looking for additional authorities, legislative authorities, and those will focus on areas like SBOM, areas like coordinated vulnerability disclosure, which is right now really a voluntary effort. If a medical device manufacturer chooses to be proactive, we believe that it should be required across the board to level the playing field. And then also in terms of additional authorities around what it is that we could require of manufacturers to be included within their pre-market submission that has really, ramifications towards the entire product life cycle. And what I mean by that is evidence that the device is capable of being patched and updated without having failures of performance. So that those are examples of things that are really important to us in terms of FDA directly. There's a lot that we're working on in partnership with the private sector that will be coming out over the course of this year. A lot of our work, just to also highlight, is very patient-centric and patient engagement focused. So we are working on a framework for how to communicate to patients about vulnerabilities and how to empower patients who rely on medical devices better so that they know the questions to ask of their clinicians, because that will really raise the bar even for clinicians to be better aware if they're going to be hearing questions from their patients around cybersecurity.
Yeah.
Those are just some of the examples.
Well, I have to tell you, it is also encouraging to me to hear about giving the FDA a little bit more teeth in how they deal with the medical device manufacturers, because it is a life cycle issue. And, obviously, I think medical device manufacturers, they want to do a good job, but they're under their own constraints that they're dealing with in this particular space. So I think this is a really good thing, and I'm very encouraged to hear that. I did hear a story the other day where, a certain provider network had, been the subject of a breach, and, and this was actually in a coffee shop, and this person said, "You know what? I'm not going to that hospital anymore. I'm going to the other one down the road." So I get a sense that people are becoming more aware, even folks that are not in this business, that there is a difference and it is important, and they are going to make potential decisions in their life based on who's protecting their data, and of course in this particular case, patient safety is paramount.
Sure. Absolutely.
Well, look, I really appreciate, as always, your time today, Suzanne. It's been great chatting with you, and thank you for joining us.
Thank you, Carl. It's wonderful to be with you.
It's almost time for our closing keynote, which I'm sure you're not going to want to miss. You know what time it is. It's time for another break, so we'll see you back here in 5 minutes.